Good afternoon, everyone. I am Narhani Ampanas Ungad, a student nurse of Universidad de Zamboanga Pagadian branch. So today I will be performing a history interview on the patient. So before we can perform, we need to of course wash our hands. So let's start.
Totoo ba? Gusto ka kay ate?
Tutuloy mo pa ba ang plano mo?
Yes. Patawag na ako ng board meeting.
Alam na ni Princess.
Pagkatapos ng board meeting, kakusapin ko na si Princess. Hindi pa maliwanag ko sa kanyang lahat.
That little freak. My friend.
Hello, ma'am. Good afternoon. Good afternoon, din. Okay, so I am Narhani Ungad. I am your nurse for today. So, and I will be assisting you for today. So, may I know your full name?
I am Johanny Ungad.
Johanny Ungad. So, all right, Johanny. So, Johanny, I will be helping you for today. Okay. Okay. So, but in order to do that, I need to take your history. I'll be asking you some personal questions and also questions regarding your health. And as I do that, I will be taking down muscular reference. Will that be okay with you?
Yes, nurse.
Yes. Okay, good. So, rest assured that all information that I will be taking down will be kept confidential, okay?
Yes.
Okay, so let's start with some information. So, who is Johanny Ungad rather? Where do you live?
At Nulabangan, Zamboanga del Sur.
Okay, when is your birthday?
June 9, 2010.
June. Okay, your birthplace?
At Tupuran, Zamboanga del Sur.
Tupuran. Okay, so, alright, are you a pure Filipino?
Yes, I am pure Filipino.
Okay, that's good. Okay, so your status in a relationship, single or married?
Single.
Single. Okay, so your religion?
Islam.
Islam. Okay, so aside from Tagalog and English, what other languages do you speak?
I can speak in Maguindanao because both of my parents is Muslim.
Okay, alright. So, are you still a student or do you have a job?
I am still a student.
That's good to hear. Alright. Okay, so, where do you live with?
I live with my parents and my siblings.
Okay, alright. That's good to hear. So, aside from your family, is there other support people that you have?
Now,
So, okay, so let's proceed now to the major health concerns. So, why did you visit us today?
because I have dry cough, 2 araw na po.
Okay, so, have you had any past consultation?
Yes, before.
So, alright, so did they give you any medications?
Yes.
Yes. What medications that they gave you?
It's different kind of pain, so it's not the same.
Okay, so, alright, so, but are you comfortable seeking healthcare from us?
Yes, of course, I'm comfortable.
Okay. Okay, so that's good to hear. So, you are complaining about a dry cough. Okay, so when did it begin?
It began 4 days ago, pero mas okay na po siya ngayon dahil sa mga gamot na naiinom ko.
Okay, so, what kind of medicine are you taking?
Paracetamol lang po.
Paracetamol. So, other medications aside from paracetamol?
Paracetamol at Ibuprofen lang po.
Okay, so when does your cough start? Is it in the morning, in the afternoon, or evening?
Minsan pa, kapag umaga po, hindi po malala kapag gabi, ganun po, umaatake po sa akin.
Okay. Okay, that's good to hear. So, does it hurt when you cough?
Not really, medyo makati lang po yung lalamunan ko.
Okay, so, can you rate the severity of your cough? For me, 1 being the lowest and 10 being the highest.
Maybe 4 out of 10.
Okay, so, okay, so have you noticed anything that makes it better or make it worse?
I can say that na mas naging okay ito after sa mga iniinom po ng medication. Pero lumala po ito, especially pagkagabi.
Alright, so other than your cough, are there any signs of symptoms that you notice?
It also experiencing a mild headache.
Okay, alright, so does this cough and mild headache affect your daily activities?
Yes, sometimes. Because I can't do my activities well because of this.
Okay, understood. So now let's proceed to your past health history, okay? Okay, so I will be asking you some of your medications in the past, also your illnesses in the past. So, have you had any problem occur?
No, I think I'm healthy baby at birth.
Okay, that's good to hear. So, do you had any childhood illness?
Chickenpox and flu.
Chickenpox and flu. So, okay, so, do you have any vaccinations?
I think I had complete immunization vaccine as a child.
Okay, so, how about adult illnesses such as an asthma, diabetes, hypertension?
No.
Okay, none. Okay, so have you had any surgeries at all?
Not so far.
None so far. So, have you had any pregnancies?
No.
How about accident or injuries?
No.
Okay, so how about your medications aside from the paracetamol and ibuprofen? Other medications that you took in the past?
Just pain relievers.
Pain relievers. Okay, so that's good to hear. So, ma'am, do you have allergies?
I don't have any allergies.
Okay, so good. So, now let's move to your family health history. So, are there any illnesses that runs in your family?
I think hypertension and kidney failure.
Okay, so have you noticed what age does your family member get this kidney failure or diseases?
I think 15 up.
15 up. Alright, so Johanny, I will be asking you further questions about your body system. So, okay, let's begin. So, let's start with your integument. So, is there any changes in your skin, hair, and nails?
I think it is normal.
Normal. Okay, so that's good to hear. So, so you don't experience any rashes at all?
Yes.
Okay, so how about hair loss?
Maybe hair loss, but it is mild only.
Okay, so moving on. So, do you find it difficult to swallow?
No.
No. So, may I ask your eye vision?
I think my left eye is 120 and my right eye is 150.
Okay, so how about eye infection? Have you had eye infections?
Not so far.
Okay, any other complications in your eyes?
None.
None. Okay, so how about in your ears, in your hearing? Is there any problem with your hearing?
Both of my ears is normal.
Okay, so that's good to hear. So, how about in your oral cavity? Any complications there?
I think it is okay.
Okay. Okay, so there are no problems with your gums?
Yes, none.
Okay, good. So, how about frequent colds? Do you experience frequent cold?
Yes, 3 days ago. I think I have still a cough and cold right now.
Okay, so because of this cough and cold, do you sneeze a lot?
Yes, I sneeze a lot.
Okay. And then, that's good to hear, ma'am. So, okay, so, are your nose and eyes itchy as well?
Not really, but medyo mas makati lang sa lalamunan.
Okay, so, moving on, do you find it difficult to breathe?
I think my breathing is okay.
Okay, so, no shortness of breath?
No.
No. So, and then, okay, that's good to hear. So, let's move on to your breast. Do you know how to self-examine your breast?
Yes.
Yes. So, when was your last breast examination?
I do examinating every week.
Every week. So, every week. So, wow, that's good. That's really good. So, have you noticed any lumps or discharge in your breast?
No, I think it's all normal.
Okay, it's all normal. So, any changes or resize in your breast?
No.
None. Okay, so have you checked your last blood pressure?
Yeah, I have a low blood pressure.
So about 90/60.
Yes.
Yes. So have you experienced any palpitations?
Yes, I think it's because I love drinking coffee.
Okay, that's all right. So so much coffee is bad for you. Okay. So how about edema? Had you experienced any swelling in your body?
No.
Okay, so do you experience cramping in your legs?
Yes, but only once.
Only once. Okay, so how about in your abdomen? Do you experience any indigestions?
No, I think it's okay.
It's okay. And then, so you don't feel nauseous? So you don't feel like vomiting?
No, I don't.
So, okay, so do you experience any abdominal pain or cramps?
No.
No. Okay, so Johanny, I will ask you about your genitalia. Okay?
Okay.
So, some of these might be sensitive questions. So, alright, have you experienced any sexual problems, STDs?
Not so far.
None so far. Okay, so when was your last menstruation?
On February 15, 2022.
February 15, 2022. Okay, so are you a regular or irregular?
Regular.
Regular. Alright, that's good to hear. So, Johanny, what is the length of your period?
5 to 6 days.
5 to 6 days. So, how about bowels happens? Do you feel any discomfort?
Not so far.
None so far. Have you not experienced any diarrhea?
None.
Okay, so have you noticed any blood in your stool in the past?
No.
Okay, so how about stiffness in your joints? Do you find it difficult doing daily activities?
I think in my back.
Okay. Okay, so in your back. So why do you think so?
Because I have a mild scoliosis.
Okay, so mild scoliosis, alright. So now let's talk about your mental health. So how have you been lately? How are you feeling lately?
I feel good.
Okay, that's good to hear. So any signs of anxiety or depressions?
I think I'm good.
Okay, that's good to hear. So okay, so Johanny, let's move on to your lifestyle and health practices, okay?
Okay.
Okay, so I'll ask you about what you're doing in a day, okay? So can you describe me what is your typical days?
I think waking up, have some coffee, study, play with my cats, eat, of course, sleep.
Okay, that's good to hear. About your nutrition and weight management. So, what do you usually eat during the day?
I love eating salad. Sometimes I eat bread and coffee in the morning.
All right. So, how often do you eat in a day?
In 3 times in a day.
Okay. All right. So, it is on the right time.
Yes.
Okay. So, good. Do you eat in the restaurant frequently?
Not that much, especially this pandemic.
Yes. Okay. Okay, so Johanny, do you eat only when you're hungry or do you do stress eating?
I eat especially when I am tired.
Okay, so who buys and prepares your fruits?
My mother.
So, where do you eat your meals? Is it in the kitchen or in your room?
Sometimes in the kitchen, sometimes in my room.
Okay, so have you had discomfort eating at other places?
No.
So, what fluids do you drink?
I drink a lot of water.
Okay, so Miss Johanny, let's move on to your activity levels and exercises. So, what is your daily pattern of activity every day? So, do you exercise daily?
I don't exercise that much.
Okay, so you don't follow any exercise plan?
Yes, I don't.
Okay, so your other recreation or activities?
Walk with my cat and watching movies with my friends.
Okay, so alright, so let's talk about your sleeping patterns.
I sleep with 9 to 6 p.m.
9 to 6 p.m. So that's good. So when you wake up in the morning, do you feel motivated or tired?
I feel motivated.
Okay, that's good. So let's proceed. Okay, so Johanny, do you drink any alcoholic?
Not so far.
And so far, so okay. So how much coffee do you drink each day?
I think 3 cups of coffee in a day.
Okay, so have you ever had any experience in smoking?
No.
Have you ever had taken medicines which is not prescribed by your physician?
Yes, but only pain reliever.
Okay, so do you take it every day?
No.
Okay, so you haven't used any recreational drugs?
Not so far.
Okay, so do you take any vitamins or any herbal supplements?
Yes, I take vitamins like ascorbic acid.
Okay. So there's some personal questions here, okay? Okay, so what do you see as your talent?
Socializing with all the people.
Okay, so that's good to hear. So how do you feel about yourself?
Sometimes feel insecure in my weight on how I look, but I have little bit confidence now.
Okay, so that's normal. So can you tell me what activities you do to keep yourself healthy or to prevent any diseases?
I try to eat healthy foods and drink a lot of water.
Okay, so this is a sensitive question, Johanny. Okay, so do you practice sex or do you engage in any sexual activities?
I don't have experience.
Okay, so how do you keep your home safe?
I think proper sanitation and following on the protocols.
Okay, so that's good to hear. So do you attend any medical checkups at all?
At the dentist sometimes.
Okay. And then, so, but any for your medical conditions?
I think once every year.
Okay, that's good. So, okay, so more personal questions. So here, so what do you do for fun and relaxation?
Usually hang with my families and friends.
Okay, so are you involved in any community activities?
No,
No. Okay, so how do you feel in your community?
I feel safe.
Safe. So, Johanny, as of the moment, do you think you have enough time to socialize with other people?
Not that much, but I do try socialize.
Okay, so what do you think is your contribution to your community or society?
I think supporting their plans and their project.
Okay, that's good to hear. Okay, so that's great. So, may I ask, who are the most important people in your life?
My family.
Okay, so that's good to hear. So, Joanny, do you have a close relationship with them?
Yes, we are very close.
Okay, so how was your growing up with your family?
It's really happy and fun.
Okay, so let's move on to your beliefs. So, what is the most important to you in your life?
Enjoy life each day and to be grateful.
Okay, that's good to hear. So, okay, so what do you want to accomplish in your life after your journey?
I want to travel and give back to my parents.
Okay, so do you have any religious association?
Yes, I am Muslim. I believe in God, Allah.
Okay, so what is your strength?
My family gives me strength. Of course, my friends.
Okay, that's good. So, okay, so Johanny, you are in the last portion of our interview, okay?
Okay.
Okay, so tell me about your experience in your school.
Sa ngayon, hindi masyadong maganda, lalo sa module lang.
Okay, so you are not satisfied.
Yes, I am not satisfied.
Okay, so may I ask who is the main provider in your family?
My father.
Your father. Okay, so let's move on to your stress level. So what things make you angry?
I hate liars.
Okay, so that's good to hear. So how would you describe your stress level from 1 to 10?
Maybe 5 out of 10.
Okay. So, how do you manage your stress?
I just play with my cats. Sometimes I sleep.
Okay, so in this sometimes diba okay, so in times of trouble or crisis, so where do you turn for help?
Into my families or in my friends.
Okay, so what risk are you aware of in your environment?
COVID-19.
COVID-19, yes. Okay, so what type of precautions do you take?
Good hygiene and practicing protocols.
Okay, so good items, that's good. So, do you believe that you're ever in danger of any violence?
Yes, but I always pray to God.
Okay, that's great. I do the same. And then, so Johanny, I think that's the end of for this interview. So let me just restate all the information that you have given to me. So you are Johanny Ungad, 12 years old, female student consulting for dry cough, dry cough. So, your cough started 2 days ago, and it is worse during the evening. So, you rated severity of your cough as 4 out of 10. Okay, so you also experience mild headache and itchiness of your throat together with this cough, and then you take medication such as paracetamol and ibuprofen to make your cough better. Okay, so for this interview, I will call you for further instructions or examinations. Okay, so do you have any questions?
No.
Okay, not so far. So, thank you for your time and stay safe.
Stay safe and for mom.
Okay, so. Okay, so bye po.
Goodbye then.
So after taking the interview, so don't forget to wash your hands.